Let me talk for a moment about our nursing homes and kind of bring everybody up to date on some data as we look at one of the slides. We know that this is where we've seen a large number of our cases, over half of our deaths. And, we put a real emphasis on going into the nursing homes, into the assisted living. And now we're, leading up to something we're going to start next week, which is where we are going to continue to put vaccine into the nursing homes so that people who may have missed it the first time, or new residents who are coming in who have not been vaccinated, or new employees are coming in. So it's very important for us to do that. But let me take a look at the slide. This is a slide, and is comparing. These are cases, long-term care, as well as the general cases. So what you will see here in the black, and you can follow it through here, but what you see in the black is number of cases, and they're obviously scaled differently, and you can see on each side of the chart. But the number of cases generally in the state that we have, and then the number of cases that week in the nursing homes. And so what you can see is a rather dramatic change. They're both going down, but the number of cases in the nursing home, which is this light blue that you see right here, has gone down much more dramatically. So it is something that we really are very happy to see. And just to take a couple snapshots, November 29th, 2020, there were 2,697 cases in our long-term care facilities, of the new cases. The week of January 17th, that week, that number was down to 612. That is a very, very, very significant drop, 77% drop. And again, you see it here. Now, these numbers from here on are still incomplete, so we don't have the full numbers yet. But even if you go out here, you see quite a change. So we're very, very happy with that. And that's a very good thing as we see. Now we're going to go look at the hospital slides, Eric, if we could do that. I guess you got them up there already. We continue to go down. We're very, very happy about that. 1,862 people in our hospitals now who have COVID, and you can see how this number has gone down. Probably a couple causes. One is the lowering of cases overall, but another one, I'm sure, is the chart that we showed you just a moment ago, which is when we've really tamped the fire down in the nursing homes. Those are people who many times end up in the hospital. We've had over half the deaths have come out of the nursing home, so probably half the hospitalizations have come out of the nursing home. So one of the real benefits, obviously the most direct benefit, is to that particular resident of the nursing home who doesn't get the COVID. But we also have the benefit of freeing more space up in our hospitals. And so when you look at this coming down in the hospitals, it is a result of lower cases overall, but it's also a result of significant vaccination in those nursing homes. So we're very happy about that. And one of the fringe benefits, as we see this number, the curfew, we indicated 2 weeks ago that if we got below 2,500, and if we got below 2,500 and we kept that for 7 days, well, we've blown through that. And what we said is if we did that, then we would be able to take the curfew off. So the curfew actually expired officially at noon today, so there's no curfew. Now, we may in the future, we don't know, have to put a curfew back on. We certainly hope we do not. But it's very important, and I think all the doctors will say, very important for us to continue to do what we've been doing. Let's get the vaccine into our arms as quick as we can, but at the same time, we've got to continue to wear a mask. We've got to continue to keep the distancing. We check on the mask wearing every week, sampling throughout the state of Ohio. In retail establishments, it's about 93%, and it's been holding steady. So we got to keep it up there. That's just part of what we're going to have to do as we go through this period of time. What we don't know is what's going to happen with the variants. You've seen some of the national stories about how fast it replicates. We don't know. So we could be back in a situation where we have climbing cases. We certainly hope we don't do that. But we all can control this to some extent. And one way we can control is to continue to wear masks, continue to keep the distance, whether it's in the workplace, whether it's in schools, whether it's in our own personal lives.